Welcome to the deep dive.
Hey there.
Our mission, well, it's pretty simple. We take your source material, we dig into it, and we pull out the key nuggets, the most important bits of knowledge.
All to help you get up to speed quickly and thoroughly. Think of us as your guide through the info you've already gathered.
Exactly. Finding those core value points. And today, we're diving into something really practical, especially if you're looking at a certain career path.
Right. We're exploring key interview questions for a physical therapy aide, a PTA role.
And our material for this comes from the Kaplan Community Career Center.
Yep. It lays out some, common questions you might get asked in a PTA interview. It even gives suggested answers and some background on related jobs and tools.
So the plan is we'll walk through these questions from the source one by one. We'll unpack what they're really asking.
And what the source suggests makes a solid answer, sort of getting inside the interviewer's thinking, using this material as our guide.
Yeah, because understanding the why behind the question is just as important as knowing what to say, right?
Yeah, absolutely. It helps you frame a response that really shows you fit the role, at least according to this source's perspective.
Okay, let's jump right in. First question the source highlights. Why did you choose to become a physical therapy aide?
The classic opener.
Feels pretty fundamental, especially, in a caring field like physical therapy.
Totally. And according to the source's suggested answer, they're often looking for things like, well, a clear interest in healthcare, wanting to help people,
Makes sense.
genuine enjoyment in actually assisting patients with recovery, and getting satisfaction from seeing them make progress in therapy.
Okay, that all sounds logical. But let's dig a bit deeper. Why this question almost always first? What's it telling them early on?
Well, it's less about, your whole life story and more about gauging your basic motivation. Are you aligned with what this job is actually about?
Right, not just any job.
Exactly. They want to see if you connect with the mission, specifically supporting physical recovery. That takes patience, empathy. It shows if you grasp the core of what a PPA does.
And I can definitely see how watching patients progress, seeing that improvement, that must be really fulfilling.
It really is. It suggests you value that direct impact
Right.
on someone getting back movement or strength. It's rewarding work.
All right, let's move to the second question the source brings up. What experience do you have as a physical therapy aide? How does the source say to tackle this one?
The suggested answer highlights a few things. Completing a training program, mentioning years of experience if you have them,
Okay.
experience in both inpatient and outpatient settings, and having assisted PTs with a wide variety of treatments and exercises.
Let's pause there. Inpatient and outpatient. The source implies knowing both is good. For someone maybe new to this, what's the basic difference?
Good question. So generally, inpatient means patients are staying overnight, think hospitals, maybe a rehab facility.
Got it.
Outpatient is more like clinic visits. Patients come in for therapy, then head home. They present sort of different dynamics.
Okay, that clarifies it. So why is showing that range of experience, different settings, various treatments so valuable, even if you don't have tons of years behind you?
It really signals adaptability. It
Yeah.
shows you have to have a broader grasp of patient needs across different situations. You're likely more comfortable with different types of patients, conditions, protocols.
The versatility.
Exactly. And you're right, even without years of experience, you can highlight the variety in your training, the different things you learned or practiced, maybe patients you saw in clinicals or volunteering. It still shows that potential.
That's a really important point for newcomers. Okay, strengths. Question 3. What are your strengths as a physical therapy aide? The source lists quite a few.
It does. The suggestions include things like being a quick learner, a hard worker, having a positive attitude, working well under pressure, multitasking, being a good listener, following instructions well, and importantly, working well with patients and building good rapport.
Phew. That's a lot. Looking at that list, which ones feel like the absolute must-haves for working directly with patients every day?
Well, for that direct patient interaction, I'd say positive attitude, good listener, and building rapport are just crucial, non-negotiable, really.
Why those specifically?
Because patients might be in pain, they might be frustrated, maybe scared. Your ability to connect, to really listen, and keep things positive,
Yeah.
that hugely impacts how they feel and, honestly, how willing they are to do exercises that might be tough.
That makes a lot of sense. And what about the others, like quick learner or following instructions?
Yeah.
How do they play into being effective?
Oh, those are vital for safety and just, making things run smoothly.
Mm.
A PTA works under a physical therapist's direction.
Right.
So being able to quickly grasp instructions, follow procedures exactly, maybe juggle a few things at once in a busy clinic, that ensures patient safety and keeps the therapy plan on track. You're basically a reliable part of that plan.
Okay, now this next one gets really interesting applying those traits. Question 4. Can you describe a challenging situation you have encountered as a PTA and how you handled it? The source even provides an example.
It does, yeah. The suggested scenario is dealing with a patient who's resistant to therapy, maybe not following the plan.
Why do you think that situation, patient resistance, comes up often? What makes it so challenging in PT?
Well, it's tough because it puts the therapy goals directly against how the patient is feeling, emotionally or psychologically.
Yeah.
As a PTA, you need to help carry out the PT's plan, but you can't just force someone who's unwilling or maybe afraid. It really tests your people skills, communication, empathy, handling pushback.
So, how does the source recommend handling that? What's the key idea in their approach?
The approach described involves taking time to really understand why the patient is resistant, talking through their concerns,
Hmm.
yes, listening, then working closely with the supervising PT, and maybe together finding ways to tweak the plan slightly so it aligns better with what the patient feels they can do while still hitting the main therapy goals.
What strikes me there is the focus on understanding the patient and collaborating, not just like enforcing the rules.
Exactly. It shows that good therapy is a partnership. The source's suggestion highlights how the PTA acts as the PT's eyes and ears, communicating struggles and helping find solutions together.
So, it's about teamwork.
Teamwork and being patient-centered. It kind of raises that question, how do you empower the patient by addressing their concerns, but still make sure the core plan from the PT gets done safely and effectively?
That's a delicate balance. And speaking of safety, that's clearly huge, which leads to the next question. How do you ensure the safety of your patients? What is the source list here?
The suggested answer covers several key actions, using proper body mechanics, yourself, and for the patient. Strictly following infection control rules, making sure patients are positioned right and secured during exercises or when using equipment, keeping a close watch on them the whole time,
Hmm.
monitoring how they're doing, how they're reacting, and importantly, reporting any concerns right away to the PT.
Wow, it sounds like safety is way more than just setting things up correctly. It's constant vigilance.
It really is. And what's interesting is how that answer covers both the physical side, like preventing falls or injuries during movement, and that clinical oversight piece.
How so?
Well, as a PTA, you spend a lot of direct time with the patient while they're moving, exercising. Your constant observation is key to catching things, signs of pain, fatigue, dizziness. Maybe they're not doing the exercise quite right.
Before it becomes a problem.
Exactly, before it leads to an injury. Knowing when to step in, maybe modify something or flag it for the PT, that's a massive part of safety. It's active assessment, moment by moment.
Right, you're a really critical safety link in that chain. Okay, last question from the sources list, number 6. How do you handle patient confidentiality?
The source's answer here emphasizes first just understanding why confidentiality is so important, then always following IPAIR regulations.
One.
Yep. Adhering to your specific employer's guidelines too, never discussing patient details with anyone unauthorized, and protecting their information, whether it's paper charts or electronic records.
Why is IPA specifically mentioned? And what happens practically if someone in this role slips up on those rules?
Well, OPE is the main U.S. law protecting patient health info. Mentioning it signals that this isn't just about being polite, it's a serious legal and ethical duty.
Okay.
Day to day for a PTA, this means being super careful. No chatting about patients in hallways or the break room, making sure computer screens aren't visible to just anyone, handling paperwork securely.
Just being mindful.
Constantly mindful. And knowing exactly who on the team is allowed to know what about which patient. If you mess up, the consequences can be serious legal trouble for the facility, yes, but also it completely breaks the trust patients need to have in their providers.
So it really boils down to building that trust and following the law through careful actions all day long.
Precisely. It's woven into everything you do.
So this whole discussion has really centered on these 6 interview questions from that Kaplan source material.
Yeah, and it's good context that the source also lists some related jobs where these skills and probably similar questions would pop up.
Like what?
Things like outpatient aid, rehabilitation aid, restorative aid,
Yeah.
physical therapy attendant, different titles for similar support roles.
Gotcha. Showing the skills transfer. And the source also mentions Kaplan has other career tools like an interview coach and offer analyzer.
Yes, those are mentioned in the material as other resources they offer.
Okay, so we've taken this specific source, broken down these common PTA interview questions, and really tried to unpack the thinking behind them as presented in the material.
And hopefully doing that paints a clearer picture for you about what employers are likely looking for in a physical therapy aide. That mix of practical skills, patient care ability, that strong commitment to safety, and just basic professional integrity.
Right. Which leaves us with a final thought for you, the listener, to chew on. If these are the questions that keep coming up, what does that signal about the absolute most vital skills and values you need? Not just to, get the PTA job, but to actually excel at it and make a real difference for the patients you're helping.